Tula was recently diagnosed with liver disease. She has elevated liver enzymes, and some of the things I'm feeding her, it may have caused it. Here's what you need to know so it doesn't happen to your dog.
Are you looking to learn more about natural pet health and wellness? You've come to the right place. Click the link to subscribe to Veterinary Secrets.
A little over a month ago, Tula went into the veterinarian because she needed to get this. Her teeth cleaned. She did fine with anesthesia. Her dental was fairly uneventful, but there's something big that showed up in her blood work. She had a few elevated liver enzymes, ALK Phos, GGT, marked elevation, and ALT, meaning she has some sort of underlying liver condition. The list is actually quite large. It may be infection, it may be inflammation, maybe to some nutrient excess. Perhaps it's aging. It means she's 13 and a half. It may be that she has some form of hepatic lipidosis, fatty liver. Maybe she's got some form of inflammatory disease causing scarring, causing these elevated liver enzymes. It's possible there's even some type of growth. There are an array of different causes and things that can affect the liver. But you need to start at the simple, the basics. You need to look at, what you're feeding your dog, or if it's a cat, what you're feeding your cat. And then look at certain things. Is there anything in her diet potentially could affect her liver? The NSAIDs, the anti-inflammatories, they could affect her liver. But you know what? She's not on any of these. Not this. She hasn't been on any other medications that potentially can then damage the liver, causing these elevated liver enzymes. Sometimes in practice, I'd have these dogs that get exposed to some of the fungal toxins, especially the dogs that go in and eat compost. But she's had no exposure to any of these fungal toxins. She's not getting into any compost. So Tula, what is it? What's going on, and why is your liver got elevated liver enzymes? One of the possibilities, too much copper. We know that copper toxicosis, that has a big detrimental effect on the liver. That's going to cause elevated liver enzymes. How would you get too much copper? Tula the poodle, she likes treats. I like her to be happy. Guess what? I feed her more treats. It's not necessarily always the wisest thing, but I'm like, oh, you like the treats. Turns out, see too many of the Mighty Wolf treats, so many of these soft treats, potentially, that could have caused her harm. The first ingredient in Mighty Wolf, and so many of these soft popular treats right now for dogs, fresh ground pork liver. That's right, it's liver. A small amount of liver given to your dog, your cat, once, twice a week. It does have a whole array of different beneficial nutrients, but the big problem is we have this liver, this big organ, it's filtering all the blood, and it's concentrating many of the nutrients. One in particular that it concentrates, it's copper. So it turns out in just 3 tablespoons of liver, that exceeds the daily requirement that a person needs for copper by 1,300%. You've already consumed way too much copper. So, and that's an average person, 150 or 60 pounds. You take a small dog like Tula, that would be about a teaspoon a day of liver. That would exceed her daily requirement of copper. I can tell you, Tula's had a heck of a lot more liver on a daily basis for a long period of time. In all likelihood, that's what's caused her underlying liver disease. And if you go into any pet supply store right now, you walk down the aisle, you look at all the soft, popular dog treats, like this guy, Mighty Wolf, which I really like it as a treat. Most of them have the number one ingredient is liver. The liver is a great way to add into the treat to keep it soft and pliable, which our pets, our dogs really like. Tastes good. You feed too much of that, potentially you're putting your dog much higher risk of developing liver disease. So what am I doing different with Tula now that she's got these elevated liver enzymes? Well, number one, stop doing whatever it is you've been doing that's potentially damaging the liver. So they're out. You want to be feeding your dog a simple, clean protein that's not going to have excess amounts of copper. When we're looking at, obviously, liver is the highest amount when you look at per unit. Next highest, though, will be found in things such as beef, will be found in things such as pork. We want to avoid those animal-based treats. We want to look at something, i.e. chicken, turkey. So I've gone and got a clean protein, relatively lower amounts of copper, freeze-dried chicken it is. But it's a nice clean protein, really low in fat, all the good things that we want for a dog that has underlying liver disease. A nice bioavailable protein, with a lot less copper. It's so much better for you. It is. Yes, good girl. Number 2, the diet. The big thing when we're trying to support our dogs that have underlying liver disease is number 1, we want to give them things that are potentially heal the liver. We want to give them foods that are easy to digest, that have high bioavailability in terms of the liver doesn't have to work really hard to then provide all the rest of the nutrients for the rest of the body. So we're thinking a very clean, easy digestible protein. We're thinking a protein that is low in copper. We're thinking fairly low levels of fat. And we're thinking in additional nutrients, in the form of a green vegetable. We know of like pro-liver healing properties. Here's an example of wanting them to try Tula with. So if you're going to continue to be feeding kibble, it's actually probably better to be making your dog's food at home. But if that's not an option, or you want to maybe do some homemade, some kibble, you want to look at a clean protein low in copper, for instance. So we're looking at non-beef, non-pork, non-big crittery, especially guys that potentially have been, in a confined space, feedlot, fed way too many things. They're going to likely have much higher levels of copper. So we're looking here, we've got turkey, chicken, whitefish. Okay, here's an option. Tula, open farm, pretty darn good food. She had been on Acana, which is a really good company, but it was a red meat formula. It's high in beef, for instance. I want to get her off way less beef. So we're changing up the kibble. But not only that, I'm going to be making some of her food at home. This is a simple 4-ingredient homemade dog food recipe. We're doing 1/3 a clean animal protein. Here I've got chicken breast. Tula is about 25 pounds. This is about a 1/2 pound of chicken. And this would be her daily requirement for animal protein. Chicken. We're gonna cook this up though. I'm still gonna be using a carbohydrate, one that's easy digestible. It's got some additional nutrients, such as B vitamins. Great for animals that have liver disease. 1/3 brown rice. Then a green vegetable that's rich in different flavonoids, for instance, that have been shown to be really beneficial for liver disease. Of all the different ones you can choose, I think kale is probably your best option. It's reasonably cost effective, and it's just this powerhouse of nutrients that can really help our dogs that have underlying liver disease. 1/3 we're using kale. We're also using a small amount of fat, number 1, to cook the chicken and the kale. Secondarily, to add a positive anti-inflammatory fat to the diet, using olive oil. So we have a chopped up chicken breast, about a cup of sort of loosely packed kale chopped up. There's the bulk of our food already, Tula. A pot of brown rice, or olive oil. 1 cup of the chicken and the kale. Okay. Kale, chicken, 1 cup into the bowl. Yum. Our brown rice, about a 1/2 cup into the bowl. Poodle, olive oil, another tablespoon. And then in, so we've got in total 2 tablespoons of olive oil, because we used 1 tablespoon to cook up the kale and the chicken. And this Tula is gonna be about your full daily requirement, maybe a little bit more. You could also consider some form of canned food as well. Something such as this guy, this clean protein chicken salmon recipe. The chicken, the salmon, the turkey, those are all real low sources of copper. We want to minimize the copper. We want to make sure there's no liver in that food, whether it's in the dry kibble, if you're feeding some of that, whether it's in the canned food, especially in our homemade food. Then the last big thing I'm doing to help Tula's liver, it's specific liver supportive supplements. Of all the different supplements out there, probably the most important one for our dogs with liver disease is milk thistle. There are hundreds of studies of milk thistle showing it to have clear benefits for virtually every underlying type of liver disease. So number 1, you want to make sure your dog is on therapeutic levels of milk thistle, 100 milligrams per 10 pounds of body weight daily. The second most important studied supplement, in my opinion, is SAMe, or S-adenosylmethionine. It's got a whole piles of studies out for it as well too. Studied for an array of the different liver diseases, and it's been shown to be especially beneficial as well. We're looking at minimal doses of the SAMe of about half, 50 milligrams per 10 pounds of body weight daily. Additional ingredients have been shown to be beneficial for liver disease. Dandelion root, a bunch of studies showing it to be especially helpful. The antioxidant vitamin E. It may really be helpful for animals that have underlying liver disease, especially if it's caused from free radical damage and some of these inflammatory disorders. The 95% curcumin, we know it's got some great studies showing it to be beneficial for many of the inflammatory diseases. It can really help aid an ailing liver. But I don't want you to give too many things at once. I want you to focus on sort of the big things. making sure you have adequate levels of milk thistle, making sure you have a liver support supplement that also includes SAMe or S-adenosylmethionine. So this is the third big pillar I'm starting to treat Tula with. It's our supplement, Dr. Jones's Ultimate Liver Support Formula for dogs and cats. Each chew contains 150 milligrams of milk thistle, 50 milligrams of S-adenosylmethionine, 50 milligrams of dandelion root. These are the top big 3 ingredients. There are 3 other supplements I need to consider adding in if your liver enzymes don't start to drop. A good quality probiotic dog supplement. We know that if the intestinal tract can function properly, it can break down those nutrients, there's less work for the liver. Secondarily, for many of these inflammatory diseases, we know there's a key role that the intestinal tract plays. In fact, it may be playing a role in causing some of that inflammation because the wrong bacteria are there. You replace it with a good bacteria, you can see less inflammation. And there's a bunch of studies showing that. Consider a good quality multi-strain probiotic supplement. We don't know the exact ones, but we know ones that are more beneficial for dogs. We've got one in particular, multi-strain, 8 different strains, and it's a high CFU. 5 billion of these beneficial bacteria per capsule. The 95% curcumin. It's a very potent anti-inflammatory supplement. It's been well used in a array of the different liver diseases. If Tula's liver enzymes don't drop, this is going to be one of the next things I add into a regimen. Then the last simple supplement, which I think in many cases is just good to be on an ongoing basis, and Tula's actually been on this for most of her life. It's a good quality omega-3 fatty acid supplement. It's inexpensive, it's anti-inflammatory, and if that underlying liver disease, it has an inflammatory basis to it, I mean, a real simple thing to start with is something like our krill oil. As I said, it's really cost effective. It can help decrease some of that inflammation. So whether it's ours or not, just ensure your dog is on a good quality essential fatty acid supplement. And in fact, as I say that, I'm thinking I'm gonna just add that in anyway, because I know she likes the krill. One of the other things you want to do, you don't want to add in too many things all at once because it's nice to know what is working or not. But she's been on the krill for most of her life, so I think you're going to stay on this krill because we know it's good for you. If your dog was on a salmon oil supplement, then you may want to be a little more concerned because we know they have higher levels of toxins. Because the krill is higher up in the food chain, virtually toxin free. A quick recap, be really cautious about what you're feeding your dog for treats. Likely if it's a soft treat, it's going to have a high amount of liver. Too much liver can damage your dog's liver. So yeah. Yes, they're good treats, but just use small amounts and just be cautious. If your dog is ever diagnosed with liver disease, then you want to switch up their diet. Number one, you want to remove any source of potentially liver inflammation, something that's going to make the liver work hard, something that's contained too much copper. You want to have a protein that's easy to digest, that's going to be low in copper, such as something like the chicken we just created, wherever it's gone to. Here it is, low in copper, clean protein. Okay. We're adding in other things that are going to benefit the new liver, i.e. the kale. And then consider some form of liver support supplement, one that includes milk thistle, one that includes SAMe, such as ours. I'm going to repeat Tula's blood work in the new year, and I'll let you know how she responds. And maybe that could potentially better help you if your dog is ever in a similar situation. Thanks so much for watching this edition of Veterinary Secrets of Tula's elevated liver enzymes. And more importantly, you know what I'm going to be doing about it and what you can do about it if this ever affects your dog. Click up there to subscribe, hit the bell to sign up for notifications, and when you click that link directly in the box below, I can send you a copy of my free book.